Doctors of Reddit, what is the weirdest thing you have walked in on a patient doing while they were waiting for you to see them? A 16-year-old girl planking on the medical waste bin while her father took photos. Picking at his genital warts. My favorite was an unruly drunk who had been exposing himself in public when he was detained by police, who evidently needed to use pepper spray to subdue him. He was squirming around on the stretcher, cuffed to one of the side rails in a paper gown yelling, "I'm sorry y'all, but my dong is on fire." Also, different guy, whacking it, in trauma bay 3 in the air. Not even a psych patient, just a dude who really needed to have his way with himself while waiting on emergent medical attention. Though this pales in comparison to story I got from one of our most hardened nurses. Dude jerks off, while in a hallway bed, to completion. Bless her heart, when the spudge hit the floor all she did was look at the guy and say, "You'd better be cleaning that up, because I'm sure as heck not." I had the same thing happen to a patient in ED. He had a sheet over him but the curtains weren't closed and he was just going at it. If anyone got near him he would immediately stop and pretend he was asleep and then keep going once we left. It was funny cause you could actually see his heart rate and stuff go up when he was doing it. Rip the loudest, door rattling fart at the exact moment the doctor opened the door. I got the "wow, that's actually impressive" look. He then proceeded to laugh and ask me about my diet. Take a good, long inhale and guess, doc. I'm a RN. I spent my first year nursing working on a high acuity surgical floor. A man in his early 20s came in for a small bowel obstruction and had the longest psych history I had ever seen. Day 1 after his surgery he wasn't my patient but I was covering my co-worker's break who was his nurse. 10 minutes after she left I decided to do a quick round of the unit just to make sure everyone was still breathing and comfortable. When I went into his room the I saw was the closest thing I ever seen to a real life go to horror movie. But somehow he had managed to get his handles on a pair of scissors. He had started cutting into his new ostomy, ripped out all of his stitches and had just randomly stabbed himself places on his abdomen. He had also straight pulled out his catheter with the ball to get it in place intact so there was a huge blood pool around his genitals on the sheets. When I walked in he stopped and stared at me for a second before stabbing himself again. I ran my ass out of there pretty quick and called security. Still get random flashbacks of that moment when I watch really gross horror movies. I once walked into the room of an elderly woman who had been given sutures in her right forearm after a fall. She was sitting upright in bed tearing the skin off of her arm and had already ripped up all of the skin with sutures in it. From what I gathered, she was unhappy with the dressing and after unraveling it with her teeth, kept pulling on whatever she could get her teeth on. Then there was the woman I discovered in the private waiting room pushing 8-inch cotton swabs, long Q-tips, up into her bag. 14 of them. It's not uncommon for me to walk in on patients touching the skeleton. It's actually a replica of my own mother's bones. She was a doctor as well, so it's always funny to see their reaction when I tell them to get their hands off my mom. No offense, but I think it's much weirder that you have a replica of your mom's skeleton than it is that people occasionally touch it. The doctor walked in on me cowering in my chair, holding my legs to my chest because a big ass motherfreaking spider suddenly appeared in the corner, trapping me in the room. As soon as she walked into the room I screamed, "Kill it, kill it, kill it, kill it, kill it." I saw the oh crap in her face when she saw it. It scurried out of the room, so she shut the door and a few seconds later I heard a few loud stomps. She came back in and said, "Good thing we already took your blood pressure." Ha, she's my favorite doctor. I am actually a doctor. As a med student, on inpatient psych rotation walked into the patient's room and she was lying on the floor getting off with her shoe. That was inpatient psych though, so let's just move past it. When I was a medical student, I was on rotation in the emergency department. I picked up the charge for the next patient I was going to see and glanced at the chief complaint. Chest pain. Pretty run of the mill. I walk over to the bay and pull back the curtain. There she is, sitting on the stretcher, devouring a bucket of KFC. Went to check on my patient. He came in with some sort of stomach bug. Anyway, he wasn't in his bed but I could hear him from the bathroom. Asked him if he was okay and he said he made a bit of a mess. No problem. Gowned and gloved. Went in. He crap all over 3 of the walls and all over the floor. I had to get help to clean up a bit and then got Sa to come in afterwards and finish the job. Honestly, if it wasn't so disgusting and foul smelling, I would actually say that's quite an accomplishment. Crap was nearly to the roof. I'm a PTA. I walked in on a patient who had removed all his own clothes, bed sheets, and the immediate surrounding room's clothing, and proceeded to finger paint them all with crap, feel bad about it, and try and wash them in the toilet tank, and sink. Yep, he's on the locked unit. It's an adventure every day. Early one morning on rounds, I walked into the room of an elderly woman who had been admitted a couple days before. She had removed her ostomy bag, smeared the contents all over herself, and was rubbing her hands together with crap all over them. I walked in quickly and asked, "Mrs. Smith," not her real name, "what are you doing?" She replied, "I'm washing my hands. Dementia's a terrible thing." I was moonlighting in an LTAC, mostly ventilator-dependent patients or complex wound management, when a very confused man kept screaming for a nurse. He wasn't my patient, and his assigned nurse was very territorial. I had had enough and went to see what he wanted, knowing full well that other nurse would get mad at me. When I walked in the room, the old man shoved his urinal towards me and lamented that it was the worst damned ginger ale he'd ever tasted. Then he took another huge gulp. I took the urinal away, and wouldn't you know, she came up to me later and fussed at me because he said I took away his ginger ale. I was getting an eye exam and after a few tests was put in a room to wait for the doctor to check my prescription. After waiting for what seemed like a long time, I got bored. While looking at the side of the exam chair, I noticed the control panel. Naturally, I'm very curious about how high this chair will raise. I figured I had time, so I tried to find out how high I could go. But just as I'm almost to what I think may be the top, the doctor walks through the door and stops short with an amused, puzzled expression on his face. Busted. I laughed nervously and lowered the chair. I needed to check rectal tone, read, stick my finger up her ass, on a 40-ish YO patient with a spine injury in the ED after a car accident. With a completely straight face, she said that she needed a minute to remove something out of there. I stepped out and asked the nurse to assist her with her endeavor. The nurse came out a few minutes later with a golf ball sized baggie of some powder, wrapped in a condom. She refused to tell me what it was. I didn't care. The ED docs were going to sort that out. Proceeded with my exam, and then left. Not a doctor. I work in a hospital, though. A friend of mine was admitted for cardiac issues to a telemetry unit, a type of monitor that continuously sends vitals to the nurses. My friend decided it would be a good idea to have a frick buddy come to visit him in the hospital. She starts off giving him a hand job and it escalates to head. As he's about to finish, I guess his vitals began to change and the monitor sent an alert to the nurse. She runs and finds him ejaculating into this chick's mouth. The old and rather large nurse slows backs out of the room and most likely went to take a shower. He was discharged the next day. Washing her feet in the exam room sink. I did that once. I was at the gym for a pap and realized my feet stunk to high heaven. I wore flats without socks. Bad idea. So I quickly rinsed and soaped my feet. I didn't want the doc to have to smell my feel while examining me. Once when I was on rounds in a nursing home where I worked to help out the regular MD with his overload of patients, I entered a male patient's room to find him holding a nurse up against the wall by her neck. She told me later that he had gotten aggressive and when she told him to stop, he simply picked her up by the neck and smashed her against the wall. Her feet were off the floor when I arrived and she was bruised and upset. Nurses get treated this way all the time. It's funny in nursing homes when patients always seem frail and broken, but when you do something that pisses them off, they will chase you down the hall and throw their walker at you. True story. Patient here. Thought I would share mine. Had to go to the pathology lab. Old guy is in there with a 3-year-old, probably his grandson. Grandson is licking the door to the pathology laboratory. Grandfather is saying nothing. Not a doctor, respiratory therapist here. Nevertheless, a newer nurse that I had become friendly with asked me to go into a patient's room with her. She explained that whenever she went in alone, she would find her patient, a man in his 60s, openly jerking it. Really creepy, apparently. Who knew? Her logic was that he would stop if a man came in the room with her. I said I would do it, and sure enough, he was punishing himself pretty intensely. Contrary to her theory, this old creepy frick kept going, maintaining complete eye contact with me, gay chicken to the extreme. I simply walked out and informed her that I had other patients to see. Eventually, he ended up in restraints. I was getting a giant bruise on my leg checked out Wednesday, and while waiting for the doctor wearing nothing but a tarp, nurse's orders, I fell asleep on the bed thing. Apparently a different nurse proceeded to open and then hold open a door to usher in a girl my age, who then woke me up jumping back screaming and going, "Oh my gosh, I am so sorry, I am so sorry." I was confused at first until I realized the tarp had blown off of me when the nurse opened the door, thus revealing my cold and slightly shriveled man meat and part of my rectum to a girl I am pretty sure I had a class with last semester. Doctor here. During my surgery rotation, I saw a lady with a wound on her leg that had maggots crawling out. Literally hundreds of them, all over the place. Took 4 of us to remove whatever we could see. She didn't seem to think anything was wrong, and it was the norm to have a maggot farm in a wound. I was out on placements for the very first time at a local nursing home, and they decided to put me in the dementia high care area. I was walking around with one of the nurses and she was introducing me to everyone. There was this one lady in her late 50s who weighed about 130-140 kilograms, took a real liking to me. I remember her saying, "Oh my, who are you?" And I told her, and she literally started getting off in front of me whilst staring into my eyes. Anyway, I went back to the nurse and she said we should get everyone ready to do their activities. I saw the big lady about 10 minutes later reading a magazine. I didn't think anything of it until I saw her lick her fingers to turn the page. Fricking. If you're well enough to frick in the hospital, you don't need to be in the hospital. Immediately start discharge orders. My mom used to be a third shift admitting clerk as part of her duties when a new baby was born to document the birth and register names. A young couple just had a baby hours ago and were already going at it on the hospital bed when my mom walked in. She swears she knocked and announced herself, but they were otherwise engaged. I'm a CNA, and one of the funniest things was when we had 2 older women sharing a room. The one was a dementia PT and the other was on bed rest. The woman on bed rest rang out via call bell, "I think someone should come down here." When I got to the room, I saw that the dementia PT had pooped all over the floor before making it to her neighbor's bedside, hands lathered in fesses, to sit down and ask if that poor woman was thirsty. When the dementia PT saw me, she just smiled and laughed, but that emotion wasn't mutual because her friend on bed rest had a look of horror in her eyes. Another, sadistically amusing moment was when 2 male points were sharing a room. They were both incredibly atrophied BC of lack of muscle use, constant, uninterrupted drug abuse, which became evident when they memorized their pain med schedule but couldn't remember my name. Neither had the strength to lift their TV remote, yet I once walked by their room while they argued to hear one threaten the other, "If you don't shut the frick up, I'm gonna kick your ass." Finally, I remember a male PT of sound mind who was a smoker and shared a room with a quadriplegic who had a trach. Obviously, we don't allow smoking in the hospital, but on my rounds one night I smelled fresh cigarette smoke. It came from that room, so I asked the guy if he had smoked. He said no, he just took his jacket out of the closet. He'd been here for a week, mind you, and that's what I smelled. I told him how unlikely that was, so he changed his story and blamed his neighbor. I couldn't think of any way to react other than to close my eyes, rub my temples, and ask, "Really?" My mother was a nurse's aide at an old folks home. She told me she saw an old man pulling mucus out of his tracheotomy hole and then eating it. Nurse here had a patient who was coming up from her. They had requested a sitter, intended to watch the patient one. We do this with confused, suicidal or otherwise unsafe folks. I hadn't gotten report, so I didn't know why the sitter was there, only that she was confused. All I knew was that she had a necrotic big toe. I realized, walking in on her trying to pick the toe off and eat it, why she needed a sitter. I'm a medical assistant. I walked in on a patient trying to put the toenails that we cut for her into her pocket. I had to command her to put them back. ED nurse here. I had a patient that I took into the behavioral unit in the emergency department. Before they enter the unit they are stripped down and wear nothing but socks and 2 gowns, one facing forwards and the other backwards. I had to draw blood from him, and while I was prepping he was saying by my applying the tourniquet and sticking the needle into his vein that alone gave him a high. After an hour or so he called his girl and she showed up to visit. He went to the bathroom. The security guard was waiting on the other side of the door and noticed the sink continuously running for a few minutes with no toilet flush or the sound of someone peeing. He knocked, spoke, no answer, unlocked the door and found him hunkered in the corner with his spoon, needle, and lighter next to him. His girl brought him gear to shoot up H in the bathroom. She was arrested and it turns out she was also pregnant. Once when I was a child, 6 or so, I was taken for my dental appointment. I have no memory of this. My mother loves to tell this story. Apparently the dentist put the gas on me and handed me the cast model of a jaw and upper teeth. Apparently the valve got an extra quarter twist because when he came back in the room I was kicked over sideways in the chair singing with the teeth model. He closed the door, walked to the waiting room and told my mother that there was something she needed to see. Anesthetist here. I walked in a birthing room to place an epidural. I found the father furiously pleasuring the spread-eagled mother who was really getting off, really working her lady button, and caressing her boobs. I had knocked. They didn't stop. I locked eyes with the mother. The father ignored me. I had been warned that they were trying to increase her oxytocin levels via orgasm, but I was unprepared. I said sorry and noped right out the door. Her RN found me sitting quietly in my office and said, "They are done for the moment. Can you come back?" Thank God I got the epidural placed in record time. A surprising amount of people go through the office drawers. I've had a lot of surgeries in my life, spanning 18 years, so you can imagine how many stories I have. The most relevant would be the following. I had reconstructive surgery on my left leg, so when they removed my epidural anesthetic they made me walk. I make it to the aisle and a few rooms down my own, slowly with the help of a walker. It is then when I see my doctor, pretty cool guy, took a chance with me and saved my leg. So I decided to wave with my free hand. My free hand was holding my gown closed. I flashed my doctor, his PAs, his patient and the family of said patient. On the plus side, my nurse proceeded to flirt with me when she walked me back to my room. My BF's favorite story to get me dry heaving is of a man in his ICU with a tracheostomy, a hole cut into your windpipe. A nurse walked in on the patient rubbing mucus coming out of that hole all over his chest because my skin's so dry there and this helps. Okay, so I have so many stories I could write a book. One in specific was a PT who was a self-proclaimed antichrist. I walked in his room to do rounds and he had cut himself and smeared blood all over his sheets, walls, and body. He was chanting some boo goo gaga satanic words, but it was so much blood I thought he had murdered someone. I had just left him about 10 minutes ago, so my curiosity set in on where all that blood came from. I looked around, lifted the covers and the freaking kid cut his femoral artery. Seriously had to call rapid response team and luckily saved his life. He was crying like a little baby. Weirdest and dumbest thing ever. One patient was jacking off while walking down the hallways naked singing "I'm Singing in the Rain." I am a doctor. I got called over to see a patient who was complaining of shortness of breath. She had been left in the hallway because a patient who had been stabbed had just come in. She starts yelling at me at the top of her lungs for being left in the hallway. Diagnosis: not short of breath. You have been visited by the Be Humble, Be Stay Humble and Believe in Yourself. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check out another video, or don't. Either way, have a great day you magnificent people.